Welcome to Dr. Mark Hyman Official. I'm Dr. Mark Hyman, a medical specialist with over 10 years of experience. Here you'll discover trusted health, nutrition, and wellness advice. Subscribe, follow, and support the channel for expert medical insights and healthier living. Good day, everyone. When we think about blood pressure after the age of 65, many of us assume the goal is simple: the lower, the better. For years, we've heard that 120/80 is the perfect number. But here's the surprising truth. When it comes to people over 65, the ideal blood pressure isn't always the same as it is for younger adults. As we age, our bodies change. Arteries naturally become less flexible, and blood pressure tends to rise. That doesn't automatically mean something is wrong. It's often a normal part of aging. Because of this, medical experts have adjusted their understanding of what's truly ideal for older adults. For many people over 65, a systolic pressure, that top number between 130 and 139, can be perfectly acceptable, especially if lowering it further causes dizziness, weakness, or an increased risk of falls. In some cases, even slightly higher numbers may be considered reasonable depending on overall health, medical history, and how a person feels. Here's the key point. The real ideal blood pressure after 65 isn't a one-size-fits-all number. It's a balance. Too high, and the risk of stroke, heart attack, and kidney problems increases. Too low, and there may be dizziness, fainting, confusion, or dangerous falls. What truly matters is individualized care. Doctors often look at the whole picture: heart health, medications, mobility, cognitive function, and overall quality of life, before deciding on a target number. Another surprise? Lifestyle changes still make a huge difference, even after 65. Gentle regular exercise, reducing salt intake, staying hydrated, managing stress, and maintaining social connections all play powerful roles in keeping blood pressure in a healthy range. So, what's the takeaway? The real ideal blood pressure after 65 is not just about hitting a specific number. It's about finding the safest range that keeps the heart protected while allowing a person to feel steady, energetic, and independent. Health isn't about chasing perfection. It's about balance, comfort, and longevity. The ideal blood pressure after 65 is not a one-size-fits-all number because aging affects every person differently. While younger adults are often told that 120/80 is the gold standard, older adults may not benefit from being pushed to exactly the same target. As we grow older, our arteries naturally become stiffer, and this can cause systolic blood pressure, the top number, to rise. For many seniors, this change is a normal part of aging, rather than a sign of disease. Because of these natural shifts, what is considered ideal must be adjusted to reflect the realities of the aging body. Health conditions also play a major role. Some older adults have diabetes, kidney disease, heart conditions, or a history of stroke. Others may be relatively healthy and active. A person who is strong, mobile, and managing few medical problems may tolerate a lower blood pressure target well. In contrast, someone who experiences dizziness, balance problems, or frailty may face serious risks if blood pressure is lowered too aggressively. Falls, fainting, and weakness can become more dangerous than slightly elevated numbers. Medications further complicate the picture. Many people over 65 take multiple prescriptions, and blood pressure drugs can interact with other treatments. The goal is not simply to reach a perfect reading on a monitor, but to maintain stability, safety, and quality of life. Doctors therefore consider the entire health profile: physical condition, symptoms, daily functioning, and personal comfort, before deciding on a target range. Individualization ensures that treatment supports overall well-being, rather than focusing narrowly on a single number. Slightly higher blood pressure numbers can be acceptable after the age of 65 because the body responds differently to treatment in later years. For many older adults, a systolic reading between 130 and 139 is considered reasonable and safe, particularly when lowering it further leads to uncomfortable or risky symptoms. While strict control may reduce cardiovascular risk in some individuals, pushing blood pressure too low can sometimes create new problems that outweigh the benefits. One common issue is dizziness, especially when standing up quickly. This condition, often called orthostatic hypotension, happens when blood pressure drops suddenly with changes in position. In older adults, this can lead to lightheadedness, blurred vision, weakness, or even fainting. A fall resulting from dizziness can cause fractures or head injuries, which are serious concerns after 65. In such cases, maintaining a slightly higher blood pressure may actually protect overall health and independence. Energy levels also matter. Some people feel fatigued, sluggish, or mentally foggy when their blood pressure is reduced too much. The goal of treatment is not only to prevent heart attacks or strokes in the future, but also to preserve day-to-day well-being. If a person feels steady, alert, and active with a systolic reading in the mid-130s, that range may be more appropriate than striving for a lower number that causes discomfort. Medical research increasingly supports a balanced approach, recognizing that moderate control can still provide cardiovascular protection without increasing fall risk. Healthcare providers weigh the potential benefits of tighter control against the real-world impact on safety and quality of life. In many cases, slightly higher numbers are not a failure of treatment, but a thoughtful adjustment that prioritizes stability and long-term health. Balance is crucial when managing blood pressure after 65 because both extremes carry real risks. When blood pressure is too high, the force of blood pushing against artery walls over time can damage vital organs. This increases the likelihood of heart attacks, strokes, kidney disease, and vision problems. High blood pressure is often called a silent condition because it may not cause noticeable symptoms until serious damage has already occurred. For older adults, uncontrolled hypertension can quietly strain the cardiovascular system and reduce long-term health and independence. At the same time, blood pressure that is too low can be equally concerning. In older individuals, overly aggressive treatment can reduce blood flow to the brain, leading to dizziness, confusion, blurred vision, and fainting. These symptoms are not just uncomfortable, they can be dangerous. Falls are one of the leading causes of injury in adults over 65, and low blood pressure significantly increases that risk. A hip fracture or head injury can dramatically affect mobility, confidence, and quality of life. There is also the issue of organ perfusion. The brain, heart, and kidneys require steady blood flow to function properly. If blood pressure drops too much, these organs may not receive adequate oxygen and nutrients. Some older adults may experience fatigue, weakness, or difficulty concentrating when their pressure is pushed too low. Finding the right balance means carefully adjusting treatment to protect the heart and blood vessels without compromising safety. It requires regular monitoring, honest communication about symptoms, and sometimes gradual medication changes. Rather than aiming for the lowest possible number, the focus should be on a stable range that reduces long-term risks while preserving daily comfort, mental clarity, and physical stability. Doctors focus on the whole person when determining blood pressure goals after 65 because a single number does not fully reflect someone's overall health. Older adults often have complex medical histories that include multiple conditions such as diabetes, arthritis, heart disease, or kidney issues. Each of these conditions can influence how blood pressure should be managed. Rather than applying a universal target, healthcare providers evaluate how blood pressure interacts with existing health concerns and treatments. Mobility is an important factor. If an older adult has balance problems, muscle weakness, or a history of falls, lowering blood pressure too aggressively may increase the risk of injury. A physician will consider whether the person can move safely, rise from a chair without dizziness, and walk confidently. Protecting independence and preventing falls often becomes just as important as reducing cardiovascular risk. Medications also require careful review. Many people over 65 take several prescriptions, and adding or adjusting blood pressure drugs can increase the chance of side effects or interactions. Doctors assess how medications affect energy levels, kidney function, and mental clarity. If a patient reports fatigue, confusion, or lightheadedness, treatment plans may need adjustment. Quality of life is another key consideration. Healthcare providers ask whether the person feels well, sleeps properly, and maintains daily activities. Someone who is active and symptom-free may tolerate different targets than someone who is frail or managing chronic illness. This comprehensive approach allows treatment to be tailored to the individual, By looking beyond the numbers and considering physical, mental, and functional health, doctors aim to create a plan that supports long-term safety, comfort, and independence rather than focusing narrowly on a blood pressure reading alone. Lifestyle changes continue to play a powerful role in managing blood pressure after the age of 65, and they can be just as effective as medication in many cases. Even small, consistent habits can lead to meaningful improvements. Regular physical activity, for example, helps keep the heart strong and blood vessels flexible. Activities such as walking, swimming, light cycling, or gentle strength training can improve circulation and lower systolic blood pressure over time. Exercise also supports balance and muscle strength, which reduces the risk of falls. Nutrition is equally important. Reducing sodium intake can significantly decrease fluid retention and lower blood pressure. Many processed foods contain hidden salt, so focusing on fresh vegetables, fruits, whole grains, lean proteins, and healthy fats can make a noticeable difference. Potassium-rich foods like bananas, spinach, beans, and sweet potatoes help balance sodium levels and support healthy blood vessel function. Staying properly hydrated is also essential, as dehydration can cause blood pressure fluctuations and dizziness. Stress management becomes increasingly valuable with age. Chronic stress triggers the release of hormones that raise blood pressure and strain the cardiovascular system. Simple techniques such as deep breathing, meditation, gentle yoga, or spending time outdoors can calm the nervous system and promote stability. Maintaining strong social connections also has measurable health benefits. Regular interaction with family, friends, or community groups reduces stress and supports emotional well-being. Adequate sleep is another key factor. Poor sleep patterns can contribute to blood pressure spikes and heart strain. Establishing a consistent sleep routine improves overall cardiovascular health. These lifestyle strategies empower older adults to take an active role in their health. Combined with appropriate medical care, healthy daily habits can help maintain stable blood pressure, enhance energy levels, and support long-term independence. Thanks for watching Dr. Mark Hyman Official. Please subscribe, like, and share this video. Stay healthy, stay informed, and see you in the next video.